My guest today has performed over 20,000 procedures on the human heart. He has threaded catheters through vessels smaller than a straw, repaired holes that have existed since before a person drew their first breath, and has replaced valves without ever opening a chest. He's one of the most skilled interventional cardiologists in South Florida, and quite possibly one of the most accessible. Because here, the thing about Dr. Shaun Smithson, he gives his patients his personal cell phone number. Not a nurse line, not a portal. His own number. He trained at the Houston Methodist DeBakey Heart and Vascular Center, one of the most storied cardiology programs in the world. Dr. Smithson holds dual board certifications and fellowship designations from both American College of Cardiology and the Society for Cardiovascular Angiography and Interventions. He specializes in structural heart disease, including conditions most people have never even heard of, but millions are quietly living with. And then, at the height of his career, he walked away from the institutional model and built something new. One Miami Medical is his answer to a healthcare system that too often treats patients like appointments. It's a concierge cardiology, world-class cardiovascular care delivered with radical presence, radical access, and the kind of trust that is rare in modern medicine. He serves patients across Miami, across Florida, and across the Caribbean. He speaks English and Spanish, and he still answers his phone. Dr. Shaun Smithson, welcome to Rooted in Resilience. Welcome back to another episode of Rooted in Resilience. I am your host, Zarina Christian, and I am joined today by the astound Dr. Shaun Smithson. Welcome, Shaun.
Thank you for having me.
It's a pleasure to have you on our show.
It's an honor. Thank you very much.
I'm glad you could join us. So before we get into the medicine, which is obviously the sauce, tell us who you are.
Well, I'm Shaun. I was born in Jamaica. I became an interventional cardiologist, and I've been in practice for 10 years. Originally, I was in private practice, and then now I have launched my own private practice, which is a concierge cardiology practice.
Wonderful.
Yeah.
And where did you grew up in Jamaica? What were you like as a kid, like living in the islands? And what was that like in that transition?
Sure. I would say I was a little bit of a shy child. I was always into sports, always family oriented. But I was always, education was always at the forefront of everything that I did. So I always relied on my education, always thought about becoming a physician ever since I was 4 years old.
Okay.
Never really thought about anything else. And basically rode education to the United States, got my education, and then came to South Florida.
Wonderful. And how old were you when you transitioned from Jamaica to the United States?
So right after high school, so 18 years old.
Okay.
Yeah.
Is there a moment from your childhood that you can trace that like made you say, I want to be a physician? And was it specifically cardiology back then, or did you not know?
Good question. No, it was the only thing I ever thought about since I was 4 years old. Mm-hmm. And taking care of people, the prestige that came with being a physician, going to my pediatrician's office and having that interaction and seeing how she interacted with patients, I think that definitely had an impact on me. And I always wanted to be a physician. There's nothing else I really thought about.
That's amazing. What did like your family and friends, like the people closest to you, what did they think you'd become?
Again, also a physician. Believe it or not, my mother is also a physician.
Okay.
And I have multiple family members who are doctors in my family. And because my mom was a physician, my grandmother actually did not want me to become a doctor, believe it or not, because of the stress and the strain that it can come with such an arduous and long-standing career. But it was the only thing I ever thought about, and it's the only thing I wanted to do.
That's awesome. So it was kind of like aligned from you were a very young child.
And interestingly, it wasn't always cardiology. Because I had skin issues when I was younger, I thought about doing dermatology. But in my first, I would say 6 weeks, once I got into medical school, they usually put you with a mentor. Okay. And that my mentor in medical school was a cardiologist. And immediately I said, this is what I want to do. not only are you able to take care of patients, but you're able to do procedures. You're able to see a wide patient population. And I enjoyed not only the intellectual aspect, but also the procedural aspect. So that's what I wanted to do.
So you would say it was really that mentor that really
Yes.
kind of drove home the decision that that's the area you wanted to practice the most.
100%. Yeah.
Did you always know that you wanted to do surgeries within cardiology?
Yes.
Or that you,
Yes, because I wanted to think and also operate. I want to use my hands and also think. So I think interventional cardiology is one of those specialties where I can do both. And then the nice thing about interventional cardiology is that it constantly evolves. We constantly get new procedures, techniques that come out every year. And learning those things keeps me invigorated and interested and, makes me love it.
So has there ever been a time during the journey, whether it was in school, through your residency, or even in practice, that you're consider taking another path that's not cardiology, or
No?
It's always been firm?
There's definitely been self-doubt. I think particularly when I was an intern and you're working 6 days a week, 12, 13 hours a day, you have these periods where you feel like you want to quit 100%. But I never thought about quitting. I thought about this is just way too difficult, but I never thought about actually quitting.
How do you pull yourself through those moments when it gets hard?
Support. I think definitely early in the journey, I had my grandmother and then my mentors as well, and then talking to people who have been there before me. And then it's the backbone is my family. So, they're my stress relief, they're my counsel, they're my peace. So that's people who I rely on.
That's amazing. So now, being a busy physician, performing surgeries, being on call all the time, having, that work-life balance and having a family, how does that all play together for you? Is it an easy balance or something that you've had to adjust to?
Definitely, it's an adjustment, and I've had to form boundaries. For example, after a certain time, I have to put my phone on silent. Particularly if we have international patients or patients who are critical, those sometimes have to take paramount, or they may take priority. But my family is my priority, so I have to put boundaries on certain patient communications, and it's a balance. I mean, some days are better than others, but it's definitely a balance.
Yeah, and it has to be a balance because, you are thriving in your career to achieve something that you wanted your entire life, basically. But you're looking to provide for your family. So you have to create those boundaries in order to protect your family and what's important to you.
100%.
And that is something that a lot of entrepreneurs lose sight of along the way. So it's really good that you're keeping that balance.
You have to always have, what are you about? What wakes you up in the morning? What drives you, and you have to keep those things in perspective. And at the end of the day, for example, I had weeks where I would not see my son because I was on call. I was just doing so many procedures, and I realized that was one of the reasons why I transitioned into controlling my schedule and being an entrepreneur, is because I saw a lot of my mentors giving their lives 30, 40 years to medicine, and their personal lives suffered. And I wanted to have better balance in my career. I rather give early, and that way I can actually experience a more balanced life with my family. So that's what I wanted to do.
Yeah, and you want to be there for, as many of the important moments and the milestones as possible. Describe a typical day for you. What does it look like from morning to night, especially on the days when you are on call or at your office? And things like
All right.
that.
So I think a better way is to describe a week, for example. So I generally set up my week where during the week I'll have 1 or 2 days on call, right? And then during that week, and the call involves usually a 24-hour call, meaning from 7 a.m. to 7 a.m. the next day, I can be called for emergencies at any time. Those days where I'm on call, I usually stack my procedures that day. So therefore, I'm in the hospital anyway if I get called. And that procedure day, which should be 1 or 2 days through the week, I'm doing 6, 7, 8 procedures that day.
Wow.
If it's not a procedure day, then I'm usually in the office seeing patients, usually follow-ups from procedures or new patients for consultations. And then I may also do televisits where there may be international patients which are not obviously in the country as well, and doing follow-ups as well.
Yeah, telehealth has become a great tool in medicine,
100%.
especially since COVID.
Hmm.
What does, if at all, anything like the weight of the day
Hmm.
do to you and impact you, like on nights when you're trying to shut down and come into your own time in your personal space?
Yeah, the weight of the day can be challenging. And that's part of the reason why I try not to have any complications. Because as you can imagine, if you have 8 procedures scheduled and you have a complication with one, the first or the second one, the whole day becomes extremely challenging. So the day starts from the night before, meaning planning the procedures, making sure I'm knowledgeable about the patients, about the medications, about the indications for the procedures, making sure the patients themselves, the morning, the day of the procedure, they understand the indications, the risks, the benefits, and that way we have a smooth transition for the day. Usually, I try to sometimes even challenge myself to keep myself invigorated by doing a challenging procedure in the day as well.
Yeah.
But as well, I try not to also overwhelm myself. So it's a tricky balance, but I usually try to get balance where it actually makes it a little bit exciting.
Yeah. So you have like your own personal surgical strategy to how
Correct.
you
Yeah,
know it's best maintained for you and like your working style.
exactly.
How do you decompress on those days, like when you come home?
So I usually have a burger. The cardiologist probably shouldn't say that, but usually I try to have a cheat meal on those days because usually I'm not eating much throughout the day. And I usually try to have a nice cheat meal at the end of the day, decompress by, watching a movie with my wife and relaxing.
Okay. That
Yeah.
sounds like a good balance.
Hmm.
So, in your training, you trained at the Houston Methodist DeBakey Heart and Vascular Center, which is one of the most prestigious programs in the world. What was that experience like, and who were the mentors that shaped you the most?
No, this experience was amazing. For many people don't know this, but the Methodist DeBakey Heart and Vascular Institute is in the Houston Medical Center. And the Houston Medical Center is the largest medical complex in the world. So you can imagine you have 20 plus hospitals in one center. So that's amazing because you have such a large amount of intellect in one area. So you're constantly challenged, you're constantly seeing new techniques, procedures, and you're constantly seeing interesting patients. So from a learning perspective, I mean, and I'm a nerd, it was amazing, it was exciting, it was great. And then the people that you're exposed to,
Yeah,
they've been there for years.
it's a lot of exposure.
Yeah, they've been there for years. The contacts they have, and then just even learning from them in terms of how they carry themselves. And I think that's one of the things that I brought a lot into my own personal practice is that a lot of my mentors, they were head of the major societies in cardiology, but they were the most humble people I knew. And then they were also the most hardworking people I knew. They were still, if I would start to complain about something, they were still going back and working. So it was hard for me to complain when you saw somebody
People
who was much
doing
older than
so-
you, working harder than you.
working
So
harder than you.
so it was an amazing experience. I still maintain contact with a lot of my mentors there. One of my mentors unfortunately passed away, Dr. Craig Pratt, and he was very influential in my own personal development.
And that just sounds like a perfect environment for just learning and growing and
Correct.
the things that you don't learn in school, you know what I mean? That are real life self-taught experience from
Correct.
being in the hospital and things like that.
Correct. And then I think one of the things that I didn't like at first, but was probably beneficial, was that it was away from what I knew.
Yeah.
Meaning it was away from quote unquote any distractions. It was away from Jamaica, South Florida. And I had to just...
You could focus.
I could just focus. It was just all medicine, which may not have been healthy at the time, but it was what I had to do to get the knowledge that I needed.
No, I can relate to that. Being in another side of healthcare, like when I started my entrepreneurial journey, I always tell people I put blinders on and I just looked forward, didn't look back,
100%.
didn't look at what was going on around me. And when I took it off, I definitely achieved a lot of the goals I had. The separating yourself from the distractions sometimes is necessary to get to where you want to be. Who challenged you the most in that experience and what did that do for you?
I think a few people challenged me, and that's why I am where I am today at every level. So many for the audience and for people that don't know is that there's the postgraduate training after medical school is called a residency. And then after a residency, you have a fellowship. And then I did another fellowship of a fellowship. So at each stage, I had mentors that challenged me. And one of the things that allowed me to be where I am today is that when we started my fellowship, one of my mentors, Dr. Quinones, he said, if we are training people to be leaders in the field. And when you have that as your first statement, you know, yes, you're a little bit overwhelmed, but at the same time, it's a challenge that you had to live up to. So when I started to do procedures in another country, when I started to do things that basically challenging myself became the norm. So that's part of,
Do you find like you start to crave that challenge and like that
yes.
putting yourself to the next level?
Yes.
It becomes a big part of entrepreneurship.
Yes. And again, part of being owning your own practice is a challenge for most physicians because most physicians don't do that. And the system doesn't really allow you to
It's not designed for that.
Correct.
It's designed for you to work within their system.
Correct. So at every stage, I pushed myself, I challenged myself, and I think it's a life lesson for many people because that's what, one, keeps you humble, keeps you hungry, and keeps you really invigorated in your path.
I completely understand. And you'll find so much more of that as you go into your own journey now in your own practice.
Correct.
It's going to keep growing you.
Yeah.
And what a lot of physicians, being in healthcare myself, that I noticed that they didn't understand, or they went to school and they focused on medicine.
Yeah.
But they didn't learn the business side.
Yeah, I'm 100%
it's not something that they're taught.
And it's not something that we're comfortable with because many physicians, and then what you're told is that you're always supposed to be about the patient, not about the money or the financial aspect. And unfortunately, that's how a lot of physicians, including myself, get taken advantage of. And in this, and the reason why I brought up the fellowship is because this is my fourth fellowship in business and managing a practice, because it is truly a fellowship because you're constantly learning. You know, my grandmother used to say that the real classroom is life.
Absolutely.
And I'm constantly in that classroom. And to me, this is my new fellowship, is learning how to manage a practice, learning the challenges that come with it, and overcoming those obstacles.
I love that. That's a great saying. I actually might take that into some real life statements.
No. She had a lot of them, believe me.
Full of knowledge and wisdom.
Yeah, man.
Help us understand what interventional cardiology is, and so the guests understand without like the jargon.
Sure. So cardiology in general is the management of cardiac disease. Most people understand cardiac disease as a heart attack. But cardiac disease involves many different things, meaning the risk factors for heart disease, such as high blood pressure, diabetes, high cholesterol. Interventional cardiology is the use of catheters, wires, or procedural techniques to manage that disease. So I was blessed with the ability to manage heart disease with these advanced procedures. So it's just using advanced procedures, typically a catheter-based procedure, to manage heart disease.
Very nice. Mm-hmm. And that's a very good explanation to separate the two so people understand, because I think there's a misconception too that, you know, those procedures can be done just by a regular cardiologist, which in fact they cannot, right? Correct.
So there's general cardiology, which is the management of patients without an invasive approach. And then there's interventional cardiology, which is management of patients with usually catheter-based techniques.
And can cardiologists, like a general cardiologist, maybe do the follow-ups for your patients? 100%. Or once they're with you, you know, they have to kind of follow that path?
100%. So most of my referrals come from cardiologists or general cardiologists. So they'll refer the patient to me, I'll operate on them, and then sometimes the patients go back to the general cardiologist. And then that's one of the things that, for some reason, a lot of times, because usually when they're sent to me, they get that immediate gratification or benefit from the procedure. So they're like, why am I seeing this guy? Why don't I just see you all the time? And I was like, no, that's your cardiologist. He sent you to me for this procedure. But yeah, that's generally how it goes.
What do you wish that every patient kind of knew before they came in? Is there something that you constantly have to be providing education on or guidance on that you find is like very typical that you have to keep telling them?
Sure. So I tell a lot of my patients, you are in charge of your health, but also you should be your own patient advocate, meaning you should know the benefits and the risks of any procedure. You should be able to speak to the person who's performing a procedure on you, and that person shouldn't be offended if you ask questions. If you're uncomfortable with the procedure, you shouldn't do the procedure. If you're uncomfortable or if you don't fully understand, you shouldn't do the procedure. So for me, an informed patient is the best patient, because if you know what's happening to you, you feel much better about whether, and again, unfortunately, if a complication happens or something like that, but it's best if you understand what's going on. That way you can actually know what's going on, be a part of the process of your own care.
Of course. And I like that you say that an informed patient is the best kind, because I am one of those patients that, I come with at my doctor's office a list of questions that, I just want to feel comfortable and understand.
100%.
And that way I can identify if I'm having a reaction to something maybe you prescribed to me or something abnormal in the course of care that maybe shouldn't be happening, because I'm aligned in what our treatment plan is and I know what it looks like and I know what it should and should not look like. So I come with a whole list of questions, and I can appreciate a physician that can appreciate that.
No, 100%. And that's one of the, I think you hit the nail on the head by saying aligned. You and your doctor should be aligned. And believe it or not, I get a lot of second opinion referrals because patients don't feel comfortable, because if they ask a question and the physician doesn't like them asking a question, it becomes this confrontational dynamic.
I've witnessed
and you
that.
And you should never go into a procedure, or especially a semi-urgent procedure, with in a confrontational dynamic.
No, I have 100%. I have experienced that when I come with my questions, because I'm seeking clarity and I want to understand what's happening. And the physician, I've had instances where they feel offended or they think it's like I'm discrediting their expertise. No, I want to understand, because you're treating me. You specialize in structural heart disease. Can you break that down for someone who's never heard of the term, and like who is at most risk for any issues in that area and probably doesn't even know it?
Sure. So structural heart disease is a branch of interventional cardiology where we manage issues with literally structures in the heart. So, for example, patients may have a valve that is leaking or a valve that is obstructed and that we have to fix. And that can actually, because of the leaking or the obstruction of that valve, it can cause symptoms or increase the risk of death or complications. And we actually have to manage those issues. So structural heart disease is a relatively new area of medicine that I was fortunate to learn while I was in Houston, where we can actually manage and place valves or fix holes in the heart without actual open heart surgery.
Oh, that's
correct.
Amazing.
Right. Wow. So patients at most risk are usually patients who are two categories of patients. Generally, patients with what we call congenital heart defects, or patients who are born with abnormalities of the heart, or patients who develop these abnormalities with age. So we can actually perform structural heart procedures on patients of any age.
Oh, wow. Yeah. And what, for things like that, what is like the youngest age that you have seen and like the oldest with those type of issues?
So because I'm an adult interventional cardiologist, the youngest patient I've done a structural heart procedure on is probably 14 years old. And this is one of the procedures I did in Jamaica, where the patient was born with a hole in the heart. And because of that hole in the heart, they were actually developing signs and symptoms consistent with congestive heart failure, shortness of breath, leg swelling, and they weren't able to carry out their normal activities. I was able to do a procedure to actually close that hole, and that gentleman was able to go back to living a regular life.
That's amazing. I actually lost a dear best friend of mine to congestive heart failure a few years ago, and she had a lot of those symptoms and signs, and she was on the list to have a heart transplant, and she didn't make it that far. And I watched her journey, and I felt so bad, because it was almost like, the physicians and the people caring for her, it was like hopelessness that was being portrayed to her. And when she had passed, I think her heart was functioning at like 14% or something like that. And they had said, it's not something she was born with
Mm-hmm.
or something that, was caused by anything. She developed it during her last pregnancy.
Sure.
Which I found very interesting.
Sure. So that condition is called a peripartum cardiomyopathy, where you have these hormones that actually cause the heart to weaken as a result of the actual pregnancy. The nice thing about structural heart disease is that we can potentially manage patients that won't be candidates for surgery, that are extremely high risk. So, for example, like your friend who unfortunately passed, she had a heart function of 10-15%. We can safely perform procedures on patients like that with structural heart disease, whereas this patient would never be a candidate for surgery.
Yeah. She had eventually got like a stent in her chest, and they were trying to do a heart transplant, but I know it was a lot of, I think, red tape, honestly. Was financial issues, insurance issues, and things like that getting in the way. And she ended up passing of, I think, heart failure while driving, which is so sad. And had more information and resources been available, her destiny could have
It's
changed.
Unfortunate, but it happens a lot, and that's another reason why you have to be an informed patient. And as you said, there's multiple factors. There's insurance, there's these other things, and that's why you have to be an informed patient.
No, that's the only way to be.
Yeah.
So PFO, patent foramen ovale, is one of the areas of your focus. I've actually never heard of that. Tell us what that actually is.
Sure. So a patent foramen ovale, or a PFO, is literally a hole in the heart. Believe it or not, we all had a PFO when we were in utero, or when you're in your mother's womb. A PFO is supposed to be closed a few hours or a few days after you're born. In a subset of the population, usually about 20% of people, that hole doesn't actually close. And because that hole doesn't close, it can be a source of stroke. So in young people who develop strokes, PFOs could be the cause, right? So one of my areas of expertise is actually closing those defects, because, and again, it's a very easy procedure to perform to basically create a successful, or reduce the risk of a long-term complication such as a stroke.
What does that procedure look like from the patient experience side?
Sure.
Is it like you said, instant gratification of feeling differently after the procedure, or is there a healing period?
Good question. So generally the patient doesn't feel any different after the procedure.
Okay.
All right. The procedure is what we call a catheter-based. I usually put a catheter via the groin, go up to the heart, cross the hole with a wire, and actually place a device across that hole. The patient usually recovers probably about 4 to 6 hours of just laying flat, and then they go home the next day.
Oh, wow.
Yeah.
Wow, that's amazing. That sounds like an ideal procedure to not have to have, weeks of downtime and
correct. And believe it or not, that used to be a procedure that you used to have to have open heart surgery for. Wow. And it's a procedure I can perform in 45 minutes.
And it's just advances in technology and resources and things now that have changed that. That's amazing.
And then the data also changed as well. We didn't initially believe that closing those defects was actually beneficial for patients, but with time, with technology, we realized that closing these defects, particularly when patients develop strokes, is actually reduces the risk of future strokes.
Wow, that's incredible, Dr. Smithson. So you have performed over 20,000 procedures. That's incredible, and you're saving lives. Is there a case, obviously without identifying anyone, we got to protect that HIPAA, that has stayed with you or reminded you why you did this work? Like you finished that case and you're like, this is why I did this.
There's a couple, but I think one of the ones that really hits home is once I started my international practice, and I had a consult from Jamaica. And this is one of the reasons why I like this case, because it touches on so many facets of my life. We got a consult from Jamaica, and it was a patient that had a specific condition that he had no option for open heart surgery. I told him, I can fix the condition, but you need to fly to United States, because again, even though I do procedures in Jamaica, we weren't able to actually bring that technology to Jamaica yet.
Okay.
The gentleman, unfortunately, had a fear of flying. So my team, we actually flew down with my team, picked him up and escorted him, and he could barely walk through the airport. And we escorted him, and we flew back up with him here. I operated on him, and the case was actually quite challenging from a technical perspective. But again, I like a challenge, and we successfully performed the procedure. And then after the procedure, the next day, I had dinner with him and his whole family. Then where it gets even better is that this same gentleman who couldn't walk, I just got invited to his daughter's wedding, and he's going to walk his daughter down the aisle. So that's a pretty nice story that stayed with me.
Yeah, and it reminds you why you do this work and why you help
100%.
people, and it's you're changing lives and saving them.
Correct.
That's amazing. I love that.
Mm-hmm.
And I had never imagined or heard of a physician that would go to such lengths to extend patient care. That's beyond patient care.
Sure. And as I said, it hit on multiple aspects of my career, because one of my mentors, Dr. Quinones, a lot of his patients that we used to see in his office were his friends, right? And I realized what made his career not boring. And you can sometimes, for example, especially if you operate on patients, you can sometimes become like a mechanic, where you have this distance and it's just robotic. And I found once you start to treat patients like how you want to be treated, and two, there is you form some connection with them, it makes medicine so much more enjoyable. And that's why, that case and a lot of my patients, I have more of a connection with them.
Yeah, I can understand that and relate to that for sure. How do you handle harder cases? I know you said you like a challenge, but how do you handle hard cases that don't necessarily go the way you wanted them to go, or the results aren't what you thought they would be?
Of course, as a person who operates, you can unfortunately have complications, and you can have death and bad outcomes. And sometimes I take it to heart. And when that does happen, I have to step back and remain, one, humble. I think that's the first key. And then two, what can I learn from the situation? How can I save another life with this information? How can I change my practice techniques? What did I do differently? What can I do differently to basically optimize or better our patient outcome? So bad outcomes unfortunately happen, but it's unfortunately part of practice.
Yeah, of course. And you are kind of just subjected to the information you're provided,
Correct.
In a summarized way of someone's lifestyle.
Right.
What issues do they have that they know of? There may be things they don't even know of that you're walking into a procedure
100%. Yeah.
blindly.
100%. Yeah.
So that is a part of the territory, but I'm glad that you have a way that you've learned to deal with that and understand that,
Yeah, you have to, because what you're going to end up doing is beating yourself up. And at the end of the day, I had to step back, especially when I have a really bad day or a bad outcome, is that I'm doing this to help people in general. It's not like I go in with the purpose of harming anybody. It can unfortunately happen.
No, it's unfortunately a risk. And sometimes the risk is you have to take the risk in order to try to save their life. Heart disease is still the leading cause of death in the United States. So
and it also makes me more rooted in my spirituality too, because you realize that I'm not in control.
Absolutely.
Even though I may have the intellect, I may have the procedural plan, I may have all these things. At the end of the day, when it's your time, it's your time. Exactly. I'm a vessel.
Are we losing the battle, or are we optimistic about heart disease in America? Do you see improvements in where things are going, where that's concerned?
I do. I think two things are happening. One, there's definitely much more patient awareness than before. I think two, sometimes, particularly in the realm, I would say, of interventional cardiology and treating heart disease or blockages in the heart, we are somewhat reaching a plateau in terms of what we can do. But the key now is going back to prevention, and before we even get there. So I think if we heighten or increase prevention, our management techniques and detection of disease, especially since we've reached a plateau in terms of managing the disease, I think we can win the battle against heart disease.
So you think that would be the thing that kind of moves the needle on so many cases of that, is more prevention and
100%.
more proactive checking?
100%. Even now, I'm seeing a lot more younger patients, and I love it, because again, even though I used to love, I would say I used to love going out in the middle of the night, and saving a life with or somebody having a heart attack. What's even more pleasurable to me is seeing a young person saying, "Hey, my family member had heart disease. I don't want to develop it. What can I do?" And that consult is much more, to me, fruitful, especially for the long term.
Yeah, because you're given a landscape to work on things versus
Sure.
limited options because you're now in a situation.
Sure.
I actually have a dear friend of mine. She's in her early 40s, and last year she had a heart attack out of
Yeah.
nowhere.
Mhm.
Eats healthy, exercises,
Yeah.
does what she's supposed to do, and there's no rhyme or reason or
Mhm.
explanation for why she had a heart attack,
Sure.
according to the physicians who saw her.
Yeah.
And now you're in your 40s as a single mom, that's scary
100%.
because it's
Yeah.
not like you had any indication.
Mhm.
She was literally at work and she just had a heart attack.
Yeah.
She started feeling like weird. She just couldn't describe it, uncomfortable, having pain, and she woke up in the hospital.
Yeah, and particularly heart disease in women has these strange presentations. And I think if, especially as a woman, diabetic, or if you have a strong family history, you need to be screened. You need to be screened at an earlier stage compared to other patient populations.
Do you find that the prevention that you're seeing more, like in the younger patients that you have, has come from a particular time? Like maybe since COVID, I feel like people have been much more aware and health conscious and wanting to take care of themselves. I've seen a big shift.
Yeah, that and technology too. People have access to care. People have access. There's Google, there's AI, there's so many resources out there. And if people feel anything, they're
Googling and you're dying. That headache is going to take you out.
Correct. And then we have the Apple devices and watches that are telling you different things. So multiple resources are actually pushing people to come to the forefront and have a formal evaluation. I will say you have to still have that formal evaluation. I think, yes, you may have, one of my mentors told me you have to interpret an EKG in the context of the history. Meaning, yes, you might have the tool to quote unquote detect disease, but you still need somebody to read that tool. So you need that formal evaluation.
Oh, absolutely. Absolutely. And people need to get more into the habit of stopping the self-diagnosing or asking, AI or Google what these symptoms are and like be proactive in their care to eliminate issues later down the line.
Exactly.
So you didn't just build a medical practice. You built One Miami Medical from the ground up.
Sure.
What was the moment you decided that and why?
Sure. So the moment I decided it was when I realized in prior practice I couldn't do what I wanted to do anymore. I wasn't able to treat the patients how I wanted to treat them, and then the mandate of the hospitals and the practice weren't in alignment with mine. And I said, this is my time. I need to actually continue to do what I want for my patients, for myself, and for myself. And I realized, and I was fortunate enough to go out on my own and actually get that done. But it was time for me to basically manage the patients how I want to manage them.
And have like your own treatment plan that you can follow through with them without like the micromanagement and scrutiny. I can imagine it limits you, but the hospitals and the practices want a certain result, but they're kind of pulling the strings. So this gives you that freedom. Sure.
As you know, as an entrepreneur, as you know, as somebody in healthcare, sometimes the mandate of the hospital is not the mandate of the physician.
Absolutely.
The hospital might say, hey, based on this diagnosis, this patient should only be here 2 or 3 days. And I think sometimes when you have this generalized approach or one-size-fits-all management style, it's not good for the patients. And I didn't want to do that anymore. And that's why I specifically wanted to do concierge cardiology and manage the patients how I wanted to be treated. I want to spend the amount of time with the patient that I want to spend the amount of time with. I didn't want to have a restriction or somebody telling me I need to see more patients or less patients. I didn't want somebody to tell me, you can't have this connection with this patient. You need to move on to the next person. So all these things kind of push me in the direction to actually manage the patients and do my own thing.
That's amazing. And I wish more physicians took that approach because sometimes you go, to the doctor's office or the hospital and you are literally just a medical record number.
Sure.
That's really what you become. And they don't build any connection or try to understand you, which will help you even when you understand them more, create a different treatment plan for them, because you'll understand things about their lifestyle and things that maybe you wouldn't know if you just came in and you had that you call it like the little doctor's visit, like 2-3 minutes, and it's in and out, and they hand you a prescription.
So and in defense, the system doesn't want that. The system doesn't allow the doctor to do that. I mean, the doctor is pressured because the insurance or the hospital says this is the amount of time you should spend on this encounter.
And it's not a one-size-fits-all.
Sure.
That's amazing. And I know you give your patients your personal cell phone number. What's the rationale behind that?
So it's funny. It kind of came out of that frustration with the system because, for example, a lot of times, if the patient wanted to get in contact with the practice, they had a difficult time to get to me. Secondly, sometimes the patient, especially if I performed a very complex procedure on the patient, I want to know what was going on, if there's a complication, and I need to know. And then a lot of times it's just, I like to treat patients how I want to be treated. So if I need to get in contact with somebody, I need to know. So that was part of the rationale for doing that.
That's amazing. I'm sure your patients greatly appreciate that and help keep those boundaries too,
Yeah. So, I mean, I have to put my phone on silent, sometimes. But, yeah.
But that's amazing. Yeah. I wish more physicians had your mindset.
Yeah. And again, that's part of another reason why I have now branched into concierge, because it's now a protected environment that I can now have those discourses without feeling, like I'm violating, whatever the hospital thinks is inappropriate for contact with the patient or something like that. Yeah.
No, they should be able to reach you, especially with something as serious as matters of the heart. You know what I mean? Those are serious, life-threatening, circumstances and issues that you don't want to have to be going through a dial-by-name directory trying to find your physician to leave a voicemail.
True. Yeah, it happens.
I wish more physicians took that approach. Mm-hmm. So, concierge cardiology, what does that actually mean? Is that something just for wealthier patients? What does that environment look like? What does that system look like in your world?
Sure. So concierge cardiology for me is simply individualized care, meaning treating the patient based on their symptomatology, based on their complaints, and based on their family history, based on their history, physical examination, and offering even more than traditional medicine avenues. So, for example, a typical patient, and it's really extending what I typically was doing for most of my patients anyway. So a lot of my patients, they may say, "Hey, doc, what do you think about this?" And they say, "Oh, no, that's not your avenue. That's cardiology." I was like, "No, you're my avenue. You're my patient. What do you need?" So usually I do a comprehensive. So for example, many times they say, "Hey, I might need a colonoscopy. Do you know somebody?" And part of my practice is we'll arrange that for the patient. So we take one of the things that we call it One Miami Medical is that it's one entity. We're one resource for everything the patient may need.
Oh, I like that.
So that's what we do. We manage everything and be a comprehensive resource for the patient.
So it's kind of like managing their care across the board, and something as, serious and in depth as their cardiology and their cardiology care, you can now manage everything that's kind of going on with them because you're kept in the loop.
Sure, because I'm a cardiologist. However, I will use my resources, my professional affiliations to help manage the patient.
That's amazing.
Yeah.
And it's good bridging that gap because it's in healthcare, it's like one patient you're taking care of, and everyone has different approaches, and it's very segmented. So 100%. Finding something that can bridge that together, so you're treating a patient as a whole, so you're aware because now their colonoscopy or their colonoscopy results could have impact to the treatment plan you choose to move forward with.
And that's exactly something I learned in training is that you can't, as you said, segment one portion or complaint or one issue from another. Everything is interrelated. And then not only that, I have a comprehensive knowledge of my patient. So I know if my patient went here and if my patient had this done, and it helps me in terms of managing the whole patient. And another reason why I went into it is that part of what I used to do all the time is that if I had an international patient that came from another country, they would usually be very satisfied with my care, and they say, hey, my mom is here as well. She needs a primary care doctor. I'd arrange that for my patients. And no, I just do that as part of my routine practice.
No, that's amazing.
Yeah.
That's really making, healthcare a whole practice.
Correct.
Which is really what it needs to be, because
Right.
it's so easy and quick to go to a doctor and they're like, oh, referral, go out.
Correct.
But then
Correct.
there's no follow through
Correct.
at the root, which is the primary care or the doctor treating, them from a whole function standpoint of what happened with those other things.
Correct.
So in my field of substance abuse and mental health, you're treating a disease that, the time of that disease has great impact to the body, the health, the heart, the way their body functions. And if more physicians had your mindset or the practice that you have, maybe the recovery of that disease would look different.
Correct.
In the long term of their patients, because now, we've treated the disease of the substance abuse or gotten the mental health issues under control. Now let's assess kind of the damage done and how do we repair those things.
Correct.
But, it's so segmented the way healthcare is now. Right. It's a big part of the problem that you're trying to solve. Right. I like that. You're known for giving patients your personal cell phone number, and we talked about this. Where did that philosophy come from, and how has that changed the relationship that you have with them? Do you think that sets you apart, with the relationship you have with your patients versus what they have with their other doctors?
I think it's just me. I think part of it I learned from when I was in training. I saw one of my mentors do it, and I thought it was a little bit strange, but I realized that one, he genuinely cared about the patients, and it formed a different form of bond with the patient. And it's also just what I inherited, and it's just who I am. And don't get me wrong, there's a few patients that abuse it, but generally there's not really an immense amount of abuse. And it has really just enhanced my ability to deliver care to those patients. And definitely it has changed my relationship with those patients. I have very extremely tight bonds with my patients. A lot of my patients are friends, family from all over the world. And again, usually it doesn't just stop at one. I usually take care of a mom, a sister, a family member, something like that. And then it has even spilled into other aspects, whether it be business, whether it be social gatherings, etc. So to me, it has created more medicine as a lifestyle for me rather than just a profession.
As a profession, I like that a lot because, too, you give people back that hope of that relationship that they can have with their physician, because so many choose not to get care or go get things looked at from a standpoint of frustration.
Correct.
Because it's either bedside manner has become such a challenge in the healthcare field,
100%.
or relatability, or the ability to open up and feel free to ask the questions that you want to ask, and you check all those boxes for the patients that you see. So I'm sure that gives them some restoration, of healthcare providers and makes them feel like, okay.
Yeah, no, I think there's a lot of fear in medicine, again, especially from what I do, right? I mean, if it's your heart, people get extremely scared. And I think sometimes when you have that level of comfort, the patient feels they're disarmed, right? They feel a lot more comfortable. They feel a lot more relaxed, especially if somebody, and it holds me accountable because there's transparency. I'm not doing anything that I feel is malaligned with my beliefs or is not in alignment with standard of care. So I have nothing to fear. And as I said, I want to treat patients with just like how I want to be treated.
Yeah, that is definitely the mindset I wish many healthcare providers in this day and age would take. I think it would allow patients to become more preventative, like you said, and feel more comfortable in medicine if more physicians took that practice or that mindset, or even a portion of it, to be honest. So you serve patients across South Florida and the Caribbean. Tell us about that international dimension and what challenges or unique cardiac health situations do you see, in those circumstances, or limitations, for that matter?
So I think a lot of this bore out of just being Jamaican and growing up in Jamaica. I've always had a love for my home country. Many people don't know this, is that I spent a lot of my summers here in South Florida because my mom lived here, and I always enjoy the international nature of medicine. I like learning about new cultures. I like managing patients from all over the world. And I like understanding how disease affects different patient populations. And I think part of being here in South Florida, you're inevitably going to interact with somebody from another country. It's
Sure.
very common that, again, most people see this, that you're going to meet somebody that isn't from here, right? And I enjoy that, and I relish learning about new cultures. And the cardiovascular disease, unfortunately, it's not biased, right? It affects everybody regardless of where you're from. And I like that. I don't like that it does that, but I like that I can use that to manage those patients from all over the Caribbean and Latin America and here in South Florida. And so, for example, it has allowed me to go back to my home country and manage patients here.
Do you find that you take a lot of the practices like that you learn here and you practice here in America or over to the Caribbean and in your practice and your procedures there? Or that you can learn too from like things that they have, that they do differently.
Sure.
Their restrictions are different than America that
Sure.
you can do differently here that you bring here that you've learned
Sure.
there.
No, 100%. There's definitely give and take between both cultures. I think I have to practice how I know. But for example, one of the things that was very obvious to me when I went back to Jamaica to start practicing there was that there's a much more economic conscious way of managing patients, right? So for example, I remember doing one of my first procedures. I was like, open everything, let's go. And they're like, no, we open things
as needed.
As needed, right? So even that economic aspect makes you, again, gives you a more complexity and gives you a higher understanding, and just enhances how you manage the patient. So I like, as I said, challenges. I like learning about how different patients are managed all over the world. And to me, it only makes me a better physician.
And that's very amazing that you would take that venture to do international cardiology practice in other countries like in the Caribbean and things like that, because you're giving people access to care that they necessarily couldn't get if they
Sure.
weren't able to leave the country.
Sure.
And something as serious as cardiac health, some people aren't in a position to travel
Sure.
regardless of financial resources. So you're bringing something to them. Their condition could be so severe that they can't fly, and that
True.
you're giving them access to a better way of healthcare,
Sure.
than what they have access to regardless of resource, which is amazing.
Yeah, no, Jamaica has given me so much. And again, one of the things my grandmother always told me is you got to go back to your country. You got to give back to your country. Your country has given you, so you got to give back to your country. So to me, it was non-negotiable. I really I was considering actually going back to Jamaica to practice medicine when I first graduated, but I realized the resources weren't there for what I wanted to do. And I was very fortunate to maintain relationships with doctors there, and they allowed me to actually go back and operate on some of those patients. And it's something I continue to do, which is something I enjoy.
That's wonderful. That's really amazing. What's the hardest part that you think you experience running a business and being a full-time interventional cardiologist at the same time? It's two completely different hats. And we said before, it's not something that you're taught in medical school. You're just taught about medicine and how to treat the patient. And then, now you have your own practice, and now you're also an entrepreneur and running your own business. What's the hardest challenge you find there?
I think the hardest challenge is to realize that you're learning again. I think especially it took me 15 years to be an interventional cardiologist, right? And you're comfortable being at this level of intellect or managing patients or aptitude. And I think going into business now, I don't know these things. I'm ignorant. And it's frustrating to be ignorant. It's frustrating to not know how to do this. And part of that frustration, I have to put aside and say, hey, you don't know this. No, you have to find the resource on how to learn this again, or how to actually do that. So you have to become a student again. And as many of us know, like, being a student is not fun, right?
Especially after you thought you've passed that phase of your life.
Correct. So I had to become humble, even more humble, and say, hey, Shaun, you don't know this. It's okay that you don't know this. And for the betterment of my family, my patients, and even for me, I have to become a student again. And that's the most difficult aspect because, again, you feel like you're at this pinnacle of your career. I've been 10 years managing patients, doing things, and you have to realize you just don't know this, and this is a new aspect. So that's part of the little bit of the frustration and keeps me up at night. But at the same time, this is my path. This is what I need to do to actually eventually have a better life for myself, for my patients, and this is what I need to do.
What's the thing that surprised you the most now that you're a CEO?
One, how expensive everything is. Everything
Yeah.
is very expensive. I think, as I said, when you are in a practice or when you work for a hospital, you walk in, everything is there. I think when you become an entrepreneur, you own the building or you own the practice, you have to be looking at cost. There is cost to these things, and just like we talked about, we don't like, especially as physicians, to associate delivery of care with cost, but it is a business. And I want to be able to set my business up where I don't have to think about cost that much, but you have to think about cost. It is a business.
Of course. The quality of equipment and supplies and things like that impact how you practice.
100%.
And it's something you got to manage. They have a saying, there's a cost to be the boss.
Yes,
And
100%.
us, entrepreneurs, we pay that price, including taxes.
Yep, 100%. Yep.
So technology is changing medicine very fast in most recent years. AI, remote monitoring, wearables. What developments in cardiology excite you the most right now?
To me, AI, as well as just the rapid evolution of interventional structural cardiology. I mean, the things that we can do now, we weren't able to do 10 years ago. And I think in 10 years, again, there's going to be another rapid evolution. I think in probably 10 years, you're going to see basically a merger between open heart surgery or cardiothoracic surgery with interventional cardiology. I think you're going to basically have combined training fellowships. I think, and then with the development of AI, I think even now we have some preliminary technology that's basically allowing us to fully plan procedures from literally stick to completion, anticipate complications, know exactly where the valve is going to be deployed, know exactly where the device is going to sit. And I think that is very exciting for me.
That's going to bring great advancements to
Correct.
how you practice and how patients receive,
Correct.
the healthcare. Is there like a place that you draw a line in the sand, with technology and say, okay, these things should not be done, or this is going too far, or you think the direction is completely where it should be going?
No, again, my dad was a computer engineer. He heavily embraced technology, and I also heavily embraced technology. My only limitation or hesitation with technology, it can't be used in isolation. You have to use it in conjunction with compassion. You have to use it in conjunction with an actual person. Again, I think there's a lot of, for example, areas where people are trying to use technology in isolation, where you're just talking to a chatbot and a chatbot is managing your blood pressure. It can't happen. Not yet. And I don't think it's appropriate for a artificial entity to manage something that is not artificial, like a human being.
Absolutely.
So to me, that's where I draw the line. I believe I can use it, but I can't use it for the entirety of the evaluation of the patient.
Use it as a tool or a resource.
Correct.
Yeah,
correct,
absolutely. So if you could redesign, the cardiology piece of the American healthcare system, what would you change first?
I would change definitely access. I think, particularly in the Caribbean, for example, many patients are still managed with very mediocre and old school techniques that to me are just, especially with the advancements that we have, that just shouldn't be done. I think access to care is one of the major limitations. And I think if a lot of people had better access to care, we could do a lot more prevention. And when prevention doesn't work, especially if the access was better, we could actually perform procedures on a lot of these patients. So to me, access is one of the major issues.
Yeah, no, that's very true, especially in Caribbean islands
Yeah.
where they're so limited. Sometimes
Yeah.
they don't even have the supplies.
Correct.
They may have a physician they could bring, and
Sure.
there's lack of supplies, tools.
Sure. And then even when I do, for example, want to do a procedure on a patient, at, a minimized cost, the access is not possible because the facility needs to get paid. We have to, as you said, the supplier has to get paid. So it's difficult, and I think that's one of the difficult things with complex procedures, that you need a facility, you need supplies, and unfortunately, patients eventually suffer.
Yeah, unfortunately,
Yeah.
that's the cost.
Mhm.
What does preventative care look like for you in your practice?
It's individualized, as I said, just like anything in our practice. We look at patients' risk factors, we look at their current active medical problems, and we see how we can actually mitigate all of those. And then we create a comprehensive profile and we say, hey, this is what you need to work on. And again, even though just because I'm a physician doesn't necessarily mean I need to prescribe, right? I think, again, coming from my grandmother who is holistic like yourself, we don't really believe in medicine, However, we believe in the ability of the body to heal itself. And a lot of, for example, things we do or we take for granted that we do, for example, the food we eat.
Food, it's our best medicine or our worst curse.
Exactly. Or just simple habits, you know what I mean? Health is not just if you're sick or not. Health is your financial health. Health is how you talk to your spouse. Health is your mental health. What the things you stress about, things that you prioritize. So I think prevention encompasses all of those things.
Absolutely. You have to keep yourself healthy as a whole and look at yourself as a whole. And you can't just keep focusing on certain parts. You have to be in completeness,
Correct.
healthy, to function at your optimal, best version of yourself, which is something I talk about a lot on this podcast, is working towards and growing to that best version of yourself. What has being a cardiologist taught you about your life and own relationship with your body and about life?
What has cardiology taught me about life? It has taught me that life is precious. Believe it or not, I can give you an example. I got called in for a procedure 3 a.m. and I was pissed. I was upset. I was annoyed. I came in. I was looking for the patient. I was like, where's the patient? They told me the patient died. So the patient died before I even got there. So it has taught me to be humble. It has taught me to really treasure life. It has taught me that you can enjoy medicine. It has taught me that I can have a large medical practice. I can treat a number of patients. It has taught me medicine can transcend borders. I can go to another country. I can have patients from all over the world. It has taught me a lot, and it continues to teach me every day. But I think humility and learning that life is precious, and the moments, and valuing those moments is very, very important. And it has actually made me closer to my family because of that.
Because of that, yeah.
Yeah.
And something as life is so precious, but something as complicated as the heart that needs to be treated so delicately, people need to be aware of signs and symptoms, or the silent symptoms, and be more educated, so they know at what point to go seek preventative care or get checked out or come see a physician like yourself.
Sure.
To help them get on that path, because it's precious, and there's so many things we can do proactively to preserve that a lot of people miss. And I think too, it's that fear of medicine. It's that fear of, what's going to happen? What's going to be the procedure? How am I going to be treated?
True.
A lot of things that you are checking the boxes on in your practice and what you're trying to bring to your patients.
Yeah.
If you could go back and speak to yourself on the first day of medical school, where you are now, what would you say?
I would say learn more about the business of medicine. I think, like most physicians, I was very focused on just gaining the knowledge. I would tell myself definitely learn more about the business of medicine. I think many physicians don't know this, is that you are the business. Patients are coming to see you, right? And I think I didn't really have that belief. I thought, I was more going into a system and I belonged to a system, whereas I didn't realize how much power I had as a physician, right? And I think if I learned more about the business of medicine, I would have probably set myself up for success much earlier. But I don't regret anything, and I think everything there's give and takes. But I definitely wish I learned more about the business of medicine earlier.
Absolutely. Unless, as a physician, you plan to stay within a hospital system or a group practice setting your whole life, you lack that knowledge and experience to be able to do it on your own. And it's kind of a learn as you go, because it's not something that they educate you on. It's just medicine.
Yeah.
And that's the only focus. And it's like you have to learn that that's also a business in itself. You are your own entity, as Dr. Smithson, and how to preserve that and grow that and nurture that from the business aspect. What's next for you and for One Miami Medical? What are you building towards, and what do we have to look forward to?
Well, there's a lot of things in the pipeline for One Miami Medical. There are certain things I can't speak about because they're, as we would say in the Caribbean, the pot is bubbling, right? But what's definitely more imminent for us is launching our global brand in the Caribbean. Basically, developing and rolling out our presence in the Caribbean in certain islands. Definitely growing our practice, solidifying relationships with our colleagues in the Caribbean, and then eventually rolling out to the Latin America. I think we have a good platform or base here in Miami, and we're looking forward to growing and expanding
and giving people that access.
Yeah.
That they so absolutely desperately need.
Yeah.
That's amazing. So what does success look like for you, but not professionally, more on the personal level?
Success is less stress. Success is waking up and not worrying about finances. Success is spending a lot more time with my son. Success is traveling, working more on, spending more personal time with my family. Success is just being able to do whatever I want in a day and not going anywhere, not feeling obligated to do anything. That's success for me.
That freedom we all crave.
Yeah.
So finally, where can people find you? Where can they find you as a physician and One Miami Medical? And what is one thing you want someone listening today to walk away with and actually do for their heart health?
Sure. So they can find me at my practice. We're available online. We're literally right by the Design District in Miami. One thing I'd probably recommend somebody to walk away from in terms of their heart health is just look at your risk factors. So the four major risk factors for heart disease are high blood pressure, high cholesterol, smoking, or diabetes. Then I'd look at your family history. If you have a family history of premature heart disease, you should be screened for heart disease and have a consultation with a cardiologist, preferably me, right? That's probably one thing I'd probably tell everybody to get screened. And I think you can get screened at really any age, particularly if you have either any of those risk factors or if you have a family history of heart disease.
What's like the first step someone should take if they feel like something's maybe wrong when they assess those risk factors or they look at their family history or they just want peace of mind?
Sure. Obviously, if it's an emergency, you have to seek medical attention immediately. But if you want peace of mind, a simple consultation is also easy as well. And I think, as I said, a lot more younger people are believing in prevention and preventative medicine, and I'm all for it.
What gives you the most hope about the future of cardiac care?
As I said, the increased awareness. That gives me more hope, seeing a lot more younger patients that are concerned about their health. I think, as I said, patients, even the younger generation now, people are smoking less and drinking less. We're now seeing people having more like those coffee raves or even these run parties and raves.
Seeing a lot of that.
Yeah, because again, there is a generational shift now because we're realizing the deleterious effects of alcohol and as well as smoking, and it's not a way of the past in terms of enjoying themselves. So people can now enjoy themselves without these things anymore. The vices are changing. But that being said, there's sometimes less human interaction because of technology. But I think I'm hopeful because we're now seeing less of the common vices. So that's why I'm hopeful.
And I think that's just going to make a huge change in the dynamic of what healthcare looks like as well. It's going to have to keep evolving.
100%.
You know, as the things that people are consumed with and consuming in excess or more than regular, what that will look like in their health, and how do we treat that going forward.
Sure.
Thank you so much for your time today, Dr. Smithson. I really appreciate it. I'm going to schedule my consultation as well.
No problem. Anytime.
Thank you for being a valued guest and sharing your knowledge and telling us about yourself and One Miami Medical.
Thank you so much for having me. I really appreciate it. I'm deeply honored. Thank you.
Thank you. If something Dr. Smithson said today stayed with you, share it. Send it to someone who needed to hear this. That is how community grows. If you are already not subscribed, please do that now on whatever platform you are listening to or watching on. It takes 2 seconds and it means everything to an independent show like this one. Follow us on Instagram at Rooted in Resilience Podcast. If you have a moment, leave a comment. It helps more people find us, and more people finding us means more conversations just like this one. I am Zarina, and this has been Rooted in Resilience. Take care of your heart in every sense of the word.